We have now moved to the genitourinary system and nursing care of the pediatric patient with a genitourinary issue. So these are some of the differences that we find in the anatomy and physiology of a child. Their kidneys are more prone to injury because they're surrounded by less fat, and they're really large in relation to the stomach of an infant or child. Their urethra is short, and this increases the risk for bacteria to be able to hook themselves into the mucosa of the urethra and climb upwards. There's also just a proximity of the urethra to the rectum, and then placing all of that into a diaper just kind of makes it worse. The glomerular filtration rate, which is the blood flow through the kidneys, is slower in infants. They're at a higher risk for dehydration. Their kidneys are not as able as ours to concentrate urine and to reabsorb a lot of the acids that they need until they're about 2 years old. So everyone under 2 years old is at a greater risk for dehydration, and dehydration leads to UTIs. The bladder capacity of a newborn is about 30 mLs. And then by 1 year of age, they've increased to what the normal adult size is, which is about 270, 280 mLs. Obviously, that stretches over time, and we hold our urine longer and longer, and we stretch it out. The reproductive organs, they're immature at birth. They don't become completely mature until adolescence. So this slide is just showing you that the basic anatomy and physiology or the basic anatomy of the genitourinary system. Fluid is more important to infants and small children because it is a larger portion of their body weight relative to their size. Their glomerular filtration rate, we already talked about that. It's pretty low. It doesn't work as well as ours do. They are, as infants, more prone to fluid volume excess as well as dehydration. We can cause trauma to the kidneys because of the lack of subcutaneous fats around the organs. And we already said the kidney function is immature until they're at least 2 years old. This is just showing you different methods of obtaining urine specimens. We would prefer to get sterile specimens using a catheter. I have never done a suprapubic aspirate on an infant or small child. I think the only reason that would be done is if they didn't have appropriate anatomy, but I'm not sure. We can do voiding stimulation, clean catches, and the placement of U-bags. There are female U-bags, male U-bags, but either of them in a pinch can be used on either gender. A clean catch, it's always a good idea to have your urine collection cup open and ready nearby, even if you're getting ready to put a U-bag on or insert a catheter, because the likelihood is that when you open them to air from the diaper and you start to clean, they're gonna start urinating. So if you can just catch it midstream, that's great. You should all know by now that E. coli is the most common cause of a urinary tract infection because it's a pooper. We can also develop urinary tract infections from E. coli related to reflux within the ureters, urinary stasis, urine retention, dehydration, and it goes hand in hand with constipation. So constipated children tend to have or develop urinary tract infections. Some of the cues you're going to see in an infant, we'll see fever, irritability, vomiting, failure to thrive because they don't want to eat because they feel like poop, and sometimes jaundice. And then in an older child, we see fever, vomiting, complaints of pain, frequency, hesitancy, urgency. Obviously, I believe that the dysuria, frequency, hesitancy, and urgency occurs in the infants as well, but we're not able to get them to explain that to us. Parents will sometimes say before the fevers started, they recognized that their infant was drawing their legs up and grimacing and crying intermittently. Usually that's because it hurts when they pee. Surprisingly enough, one of the risk factors for developing a UTI is, at least in infancy, being a boy. So male infants are more likely to develop UTIs than females. And when they are over a year old, it switches, and the females are more likely to develop urinary tract infections than the males. We manage these with either oral or IV antibiotics. If they are under a year old and they have any febrile illness, we will usually bring them in to be admitted and give them IV antibiotics for anywhere from 2 to 5 days. Most of the time, doctors are prescribing 10 to 14 days of antibiotic therapy, but the research and guidance really shows that it's just as effective to do 2 to 5 days of oral or IV antibiotics as long as you have a culture and you are gearing your treatment towards that. The complications of UTIs that are untreated is pyelonephritis. And when you see your first pyelonephritic baby, you feel really bad. They are shocky little kids. They just want to rest and sleep. When they hear any noise, they jerk, they jump, they cry. Their cry is really high pitched and wailing sounding. They are just miserable, and it is really difficult to control their fevers. So we have had some febrile seizures occur with pyelonephritic infants, and it's something we definitely need to watch out for. The actions that we're going to take as the RN is going to be education, 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 and then make the kid feel better. You know, teach the parents to, if the child is old enough to toilet, to have them sit on the toilet, and to alleviate some of the pain, use a peri bottle and squirt warm water over their genitalia so that they can urinate without all the pain. Sitz baths are helpful for infants and children and adults and elderly, everyone. And if they are developing UTIs because of chronic constipation, baths in warm, soapy water is just going to be good all around. These are some of the teaching guidelines that are in the Ricci text for preventing urinary tract infections in females. Quite a few of these can be used for males as well. We need to make sure that everybody stays hydrated. Cranberry juice, if you have a family member or a child that develops UTIs on a regular basis, cranberry juice might not be the best idea. It can lead to kidney problems and kidney stones. It would be better to avoid colas and caffeine because those are irritants to the bladder. Super fruity, sweet juices is not the best idea. If you really want to acidify the urine, drink pineapple juice. We're going to teach them to urinate as frequently as they can and don't hold their urine. We do a really poor job as parents with this because there's nothing worse than the kid who on a 2-hour long car ride has to stop to go pee it feels like 100 times. It becomes so stressful. And the only thing you keep saying is, can't you just hold it? But really, holding it is not a good idea. Um, for girls and boys, we want to avoid bubble baths. Those beautiful, smelly, colored bubbles that we put in everything, and those little bath bombs and all of that, those are bad. We should just be, if you need to make bubbles, do it with a mild soap. Don't do it with a scented bubble bath. Anything with scent in it, it's bad. We're going to teach them to wipe from front to back. We need to do the same thing with a diapered child. Um, and it's really important to, especially for females, to avoid wearing tight pants and to make sure that they wear cotton underwear and wash the perineal area daily. For girls as well, they need to change their pads frequently once they start menstruating, and we need to let them know that voiding immediately after sex is necessary, if not just getting up and showering. These might be strange conversations to have with a preteen or teenager, but they need to know. We're going to see a lot of 13-year-olds coming in with UTIs because their genes are so tight I can see their soul, and they're wearing lacy, tiny, thong, polyester underwear. None of those things are going to be helpful, and everything they clean themselves with is scented. So we need to make sure that we educate very well. And if we have frequent, repetitive UTIs with no visible source being like, oh, well, we know for a fact that the child was constipated, or we know that they were dehydrated, or whatever. If it's happening more frequently than once or twice in their early childhood, they probably need to be evaluated for ureteral reflux, and we do what's called a VCUG to evaluate for that. We squirt dye up through the urethra into the bladder, and we take pictures while we do that. And the pictures will show whether the openings of the ureters at the top portion of the bladder are allowing reflux to happen. And that's about it. Thanks.